Today I am going to be demonstrating platelet rich plasma therapy and how it works once it is injected inside your joint to regenerate and heal the tissues. In my right hand here I have a syringe full of unactivated platelet rich plasma. It looks just like blood, but this is actually highly concentrated platelets. And in my left hand I have the activating agent, which is thrombin, which is a naturally occurring protein in the body which causes platelet rich plasma to become active, biologically active, so that it can start the healing process and tissue regeneration. Now what I'm going to do, and you will see that the PRP or platelet rich plasma is liquid and that it looks just like blood, and that we're going to run it into this small container, and you can see that it's a liquid. And now the PRP swirls around and it's liquid. This is inactivated or neutral PRP. In order to make PRP start the healing and regeneration process, it must be activated, and we can buy thrombin, which is a naturally occurring protein in our own body, and if you add thrombin to platelet rich plasma, it will activate the platelets, starting the healing and tissue regeneration process. So I'm going to add just a few drops, and you can see that this is very liquid. I'm going to add a few drops of thrombin to this inactive PRP. Now that just activated the PRP, and I'm going to swirl this around, and in just a few minutes we'll be able to see, you can see that it's already starting to gel up and become very thick. That's because the platelets are now activated and they are turning into the active platelet complex. Now this activated PRP, if I were to take this and put this on a wound or on an injury where the person who donated this blood, I could actually heal up their wound or their injury with this active PRP. If I was actually to take this activated PRP and put it on someone's wound, or if they had a bad cut on the person who donated this blood, it would heal very quickly their wound or their cut, because this is now bioactive PRP, which means it's in the process of healing and tissue regeneration. And you can see here that after activating it with the thrombin, I can actually turn this upside down. Now that would have run out of there a moment ago, but now that it's activated, it has become thick like a gel or a putty. And if this was your bone surface or your meniscus, a torn meniscus or cartilage, or inside your shoulder where you're having a torn rotator cuff, this PRP clot would actually be glued to the damaged tissue, and that right where the PRP is attached to the damaged tissue is where the healing and tissue regeneration would occur. And that's the mechanism by which PRP works, is that it's right up against the damaged tissue, and with the PRP being against the damaged tissue, the healing mechanism has been activated and will regenerate brand new, stronger tissue.